Welcome back to our channel. Today we're diving into why you might experience pain after a root canal. Root canals are supposed to relieve pain, right? And you're absolutely right. Most of the time, a root canal is the best way to eliminate pain from a damaged or infected tooth. But in some cases, you might find yourself dealing with discomfort even after the procedure. So let's break down the top reasons why you might be feeling that post-root canal pain and what you can do about it. Reason number 1. So, you just had a root canal and now your tooth is throbbing. Even though root canals are designed to save your tooth, the procedure itself involves a bit of work in a sensitive area. This inflammation is a natural part of the healing process and usually subsides within a few days to a week. In the meantime, over-the-counter pain relievers and cold compresses can be your best friends. Reason number 2. Imagine this: we've cleaned out all the infection inside your tooth during the root canal. But sometimes a little bit of bacteria might have already spread to the bone surrounding the tooth. That's where antibiotics come in. If we suspect there might be some bacterial stragglers hanging around after your root canal, we might prescribe a course of antibiotics to make sure the infection is completely gone. This will help prevent the infection from coming back and causing more pain down the road. Reason number 3. You're probably thinking, wait, I just had a root canal to get rid of the infection. How can it be infected again? Well, it's rare, but it can happen. Sometimes bacteria can sneak their way back into the treated tooth, usually through a tiny gap that forms if the filling or crown loosens over time. This is why we stress the importance of good oral hygiene after a root canal. Brushing, flossing, and regular dental checkups are crucial to preventing reinfection. Reason number 4. Alright, time for a little anatomy lesson. Inside each of your teeth, there are tiny tunnels called canals that house the tooth's nerves and blood vessels. During a root canal, we need to clean out and seal every single one of these canals to prevent reinfection. But sometimes the canal can be particularly narrow, oddly shaped, or hidden from view on x-rays, making it difficult to detect. If a canal is missed during the initial root canal procedure, it can harbor bacteria and lead to pain and infection down the line. If this happens, a second root canal procedure might be necessary to treat the missed canal and address the pain. Reason number 5. Cement or air force through the root tip. So we've cleaned out the canals, and now it's time to seal them up with a special dental cement. But sometimes, just like when you're squeezing a tube of toothpaste, a little bit of that cement can get pushed out of the tip of the root during the filling process. This is called an overfill. In most cases, a slight overfill isn't a big deal. Your body will naturally absorb the excess cement over time. However, if a larger amount of cement is pushed out, or if it irritates the surrounding tissues, you might experience some pain and inflammation. Reason number 6. Oversized crown or filling. Okay, so the root canal is done and we've placed a crown or filling to protect and restore the tooth. But sometimes that crown or filling might be a tiny bit too big or too high, creating pressure on the surrounding teeth or bites, leading to pain and discomfort. The good news is that this is usually a quick and easy fix. Just schedule a visit with your dentist and we can adjust the crown or filling to make sure it fits perfectly in your bite. Reason number 7. Phantom pain. Sometimes, even after a successful root canal and a perfectly fitting crown or filling, you might still experience some lingering pain or sensitivity. This is called phantom pain, and it's thought to be caused by a sort of memory in the nerves surrounding the treated tooth. Phantom pain is typically temporary and tends to fade away on its own over time. In the meantime, over-the-counter pain relievers, relaxation techniques, and even acupuncture have been found to be helpful in managing these phantom sensations. I hope this video helped shed some light on the reasons why you might experience pain after a root canal. Remember, while some discomfort after the procedure is normal, it's always best to consult with your dentist if the pain is severe, persistent, or accompanied by other symptoms like swelling, fever, or drainage. Don't forget to give this video a thumbs up if you found it helpful, and subscribe to our channel for more informative dental tips and advice.